The topic for discussion today is the sample report analysis of the BCM, that is body composition monitor. How to interpret this and what are the clinical uses. Body composition monitor sample report analysis. Even though not an important topic from the exam point of view, for the clinical practice, what are all the uses as a nephrologist or the nephrology resident who are beginning their careers and the dialysis technicians, at least they should be aware why it is being used and how to interpret this. So first we will see in a dialysis patient. Before doing any investigation, you should be aware why that investigation is being done, what are all the uses. With that approach, once you start understanding the investigation and how you are going to interpret, that is going to give you a complete knowledge rather than blindly why, how to analyze this, rather than that, why we are doing this. First, in a dialysis patient who are having two major problems, the urine output might or might not be there, and the kidneys are not functioning, so they will be having irregular intake also. So since the urine output is irregular or plus minus depends on the patient, intake might be varying, thereby patient fluid status maintenance will be a bigger task because during dialysis water is also being removed. So if the body water content is not maintained correctly, if it is at the higher side, there is a chance the patient will go into volume overload, cardiac failure, these kind of stuff. If the body water is not adequate, the urine output might further decrease. There will be subsequent health issues because of the decreased residual urine output. Not only that, they are at highest risk of malnutrition. So you have to keep the nutrition also high. So for that, the lean body mass, the muscle mass, that have to be adequate. So we need to monitor all this. Even if the water is high in the body, the BP might not come under control. So these are all the problem in the dialysis patient. That is why there are various techniques to assess the volume status. One of the important technique is the bioimpedance technology. This is the technology using which, or we can say the base behind which, various body components can be identified. Under the bioimpedance, it is nothing but for a simple understanding. You can remember as by passing a particular amount of current, by detecting it on the receiver side, the amount of resistance and the you can say amount of resistance each compartment is giving. For example, the water content in the body might give some kind of resistance, the fat content might give some kind of resistance, the intracellular fluid might give some kind of resistance. So using these, it is detecting what is the body composition. That is the basic principle of bioimpedance. Regarding the in detail analysis of bioimpedance, I will try to upload in another video. So at least for today, you can see it is by passing the current, you are interpreting the body composition. There are various methods under which you can use a dual frequency current, single frequency, single compartment, entire body. There are various types are there. Commonly used one is the body composition monitor, in which most commonly three components being analyzed: lean body mass or lean tissue index, overhydration, how much more water there in the patient body, is the fat tissue mass. This is what body composition monitor is going to give you in the report, with which we are going to judge how much the patient is having adequate nutrition or not. So I hope clear. Bioimpedance, using the using the bioimpedance principle or bioimpedance technology, body composition monitor is going to detect in the patient what is the lean tissue mass, what is the water which is more in the body, how much water is more in the body, and how much fat mass is there. This is what the report is going to give. In a dialysis patient, what is the important report we are going to see is the overhydration. How much more water is in there in the body, and how much more water is there in the body. This is what I mostly clinicians want to know, and this is why this report is being ordered also in most of the situation, where if you are having doubt clinically, if you are having some discrepancy in the patient weight gain, quality of life, and the nutrition, that is the time we will order this report. So this is a report, sample report of a patient who underwent BCM. So let us see. It's a single sheet. The quality of the paper is somewhat poor. Somehow I got a photo and kept it here. So we will see how to interpret this one by one. So this is the entire page. This is the entire page of the report, sample report. What are all the details you will be having? This side you will be having the patient basic details. Here there will be some diagrams where some abbreviations are used. Here some values are given, and this side you are having 4 graphs. To understand or interpret this report, you should be aware of the abbreviation which are being used. See, OH means overhydration. Here the abbreviation BMI is body mass index, that everyone know. LTI is lean tissue index. FTI is fat tissue index. ECW is extracellular water. These are all the abbreviation which are used. What is this extracellular water? See, in the patient, water can be inside the cell or outside the cell. Outside the cell, it can be inside the vessel or it is in the interstitium. The extracellular water is the amount of water which is not inside the cell. Extracellular water. I hope you are understanding extracellular water. On the overhydration, how much percentage is being in the extracellular compartment? This is what we are going to get it. So this is the components of the BCM report. So one by one we will see. In this, which is the most important component, as I told, is the overhydration that we are going to see. And one more important point in the BCM analysis is the report will be given as percentile. So they will give us how much is the expected average for that particular age and sex. For example, if a 60-year-old male is there who is healthy, and if they are expecting lean tissue index to be uh, for example 50 percentile, they will come here as normal. So they give us 10 to 90 percentile is normal. Suppose if the person is more than 90 percentile, that means he is in the higher range. The uh, lean tissue index is very high. That means his muscle mass is very high, which is highly unlikely. If it is less than 10%, that means he is very low among the 10, even very low than the 10 percentage of the people. So that is why the report interpretation, usually the juniors and the technicians might be having trouble, because of these chart. They give us a percentile. They won't give us this values and all. Many a times you will get the value, but what happens is you have to interpret as a percentile. And if you have difficulty in analyzing, don't want to go into the deeper aspect of this report, just look at the overhydration along with the other clinical part. You should be knowing how much overload the patient is in. Just you can focus on the overhydration. So this page we will divide it into 4 and see one by one. First we will focus on this area. So I have cropped the image. Now we will focus on this area. This is the BCM, body composition monitor. Of a patient name I have highlighted, and the basic details are given. Height 173 centimeter, weight and the BMI is calculated accordingly. And another what is mentioned is the pre-HD BCM. They are mentioning the BCM, the body composition monitoring, was done before dialysis or after dialysis. This is what they have mentioned. So this is a specific command over here. So in this patient, they have did it pre-dialysis to know the body water status. So here it is written as body composition monitor. So this is the first section is over. We'll go to the second one. So we will remove the name again. Checking. So this too we have seen. BMI we have seen. So what is the other graphs which are present over here, or we can say as the scale diagram. OH is overhydration. Ideally, patient won't be having excessive body water. So that is why they have mentioned this as a normal. So here it is came this side. That means he is overhydrated by 2.6 liter. So he is having excess of 2.6 liter in the body. What is this LTI? LTI is lean tissue index. That is nothing but indicator of the nutrition. If the nutrition is good, he will come in the normal range. He came this side. That means he is somewhat malnourished. FT is the fat tissue index. Mostly we won't focus. Even if you want to, the nephro resident who want to know the detailed aspect of this LTI and FTI, out of these two, which is more important? LTI. It is associated with mortality and morbidity also. FTI for research purpose, and you can just see it should come in this area. How much fat compared to the proportion to the LTI. Nothing will come as absolute value. It is the proportion that we have to take. For the dialysis technologist, just focus on this one. So this is the most important one. If it comes, the arrow comes at here, that means is overhydrated by 4.5 kilo. If it comes in the minus range, -2, that means his body is depleted of water. You have removed excess water. That is why patient urine output might not be there, because you are removing everything during dialysis. Okay, we have seen this component, we have seen this component. Coming to the third one. So what they have mentioned, OH. OH is the overhydration. Overhydration is 2.6, as we have seen in that report, that scale also. In that overhydration, percentage of ECW, extracellular water, is 15%. So 15% is extracellular, the remaining obviously it might be intracellular. So another, what is next thing it is given, OH post, that overhydration post dialysis is 1.6 liter. From 2.6 liter it became 1.6 liter. Overhydration post dialysis percentage of ECF volume is how much it reduced after the dialysis. So BP they have mentioned ultrafiltrate volume. UFV is the ultrafiltrate volume. 1 liter they have removed. So as you see, the overhydration reduced to 1.6, from 2.6 to 1.6. So this bioimpedance also tells the ultrafiltrate, the machine effectively removed the whatever the volume that is set. And this also acts as a another proof that dialysis have removed the water apart from the routine weight monitoring. So BP. So what are the parameter which might affect the patient's value? Height, weight, BMI, BP. These are the parameters. So BP, post BP is given. V is urea volume. They have mentioned is the volume of distribution. They will mention, probably this will go into the higher order or higher level of analysis. You can leave this out. So in the simple terms, which one you have to focus is the overhydration. So 2.6 liter is the overhydrated. Over a period of weeks, you can plan to reduce it. So what are these four charts? See, in that bioimpedance, there are graphs with which you can make the interpretation very easy. Bioimpedance vector analysis. It itself is a separate topic regarding the graph. How to analyze the overnutrition and malnutrition. Sorry, overhydration, water more, malnutrition. Whenever these two are there, opposite to overhydration is the underhydration that we can detect. Malnutrition, it is what we want to detect. We won't look at the higher nutrition order because higher nutrition hota ही नहीं. ठीक. So these four graphs are there. What are these? This is mentioned as body composition plot, overhydration plot, hydration reference plot, nutrition reference plot. These are all the plot where x and y axis are used, with which you can see where the patient is standing. And these graph analysis, it takes a lot of time to discuss since already it is 15 minutes and above. This graph you can leave. Do we use, at least for the technicians, you can leave this graph probably. If you are get to know how to interpret, well and good. Otherwise, next video is coming probably next week. How to analyze this graph. At least in the report interpretation summary, focus on that last overhydration part. So as I shown, in the report you can see the basic details, some scales will be given, and finally there will be report of overhydration, which will be in the plus means the patient is overhydrated. If it is minus means patient is underhydrated. So it can be in the plus 2.5 liter or minus 2.5 liter. This is how this body composition monitor report have to be analyzed. Why we are doing? If excessive water is there in the body, the patient BP might not be coming under control. If less water is there in the body, patient urine output might not be maintained. If patient is not adequately nourished or patient muscle mass is going down, his quality of the life will be poor. He will be having one or other non-specific complaint or cardiac mortality increases. So that is why we are doing the BCM monitoring. In the BCM report, the parameters we always see is the overhydration, lean tissue index. In summary is this will be given as a value. The other two you can remember that can be given as a percentile. So if it is less than 10 percentile or more than 90 percentile, that comes in the abnormal range. Less than 10 percentile indicates the patient is in the abnormal nutrition group. So you can look at the photo which I have kept in the third slide, and that is what the sample report is. I hope the students got an idea regarding how to do analyze of this BCM report. In the next week video, probably we'll discuss regarding the graphs, how the graph comes, what is BIVA graph analysis. Bye bye.